It's called the silent thief of sight, and for good reason. Here's what you need to know about glaucoma. Not long ago, I had a patient named Joe that came to the office brought in by his wife. She had enough of him scraping the right side of his car against the garage. She felt it was due to his vision. He felt he was driving and seeing just fine. With a routine comprehensive eye exam, it was quickly discovered that Joe had advanced glaucoma with damage to his optic nerve affecting the right side of his vision. And he didn't even know that. And that's what makes glaucoma so dangerous, because it doesn't always involve pain, may not blur your central vision, and in the beginning it works quietly, damaging the optic nerve. That's the cable that connects the eye to the brain. By the time most people notice that there's a difference in their peripheral vision, if that peripheral vision change is from glaucoma, most likely the vision's not coming back. In this video, I'll explain what glaucoma really is, the different types of glaucoma, the patients that are at risk, and what you can do if you catch it early, before this silent thief causes permanent changes to your vision. What is glaucoma? Glaucoma, by definition, is damage to the optic nerve. That's the nerve that connects the eye to the brain and responsible for you being able to interpret what you see. It's not unlike the cable to your television. If you disconnect the cable to your TV, you're not going to see your favorite show. This damage can be caused by increased pressure inside your eye called intraocular pressure. But here's the catch. Glaucoma can even happen when eye pressures are normal. It's not just pressure of the eye that's important, but also the overall condition of your optic nerve. So there are two main branches of glaucoma, one which is called open-angle glaucoma, the other is called closed-angle glaucoma, but there are other subcategories. With open-angle glaucoma, this is the most common that we see in clinical practice. Traditionally, open-angle glaucoma progresses slowly with no symptoms in the early stages. There can be peripheral vision loss over time. Angle closure glaucoma is one of the few medical emergencies in ophthalmology, and it requires immediate attention to prevent permanent vision loss. Normal pressure glaucoma is more a problem of the optic nerve, and despite normal intraocular pressures, the optic nerve continues to progress in a diseased state. Many of us believe that this is related to poor blood flow to the back of the optic nerve. Normal pressure glaucoma is related to blood flow. The blood flow is difficult to improve because many of the blood vessels to the optic nerve are very small diameter blood vessels that only allow one blood cell through at a time. This makes it a very difficult task to improve the blood flow to the optic nerve. Secondary glaucoma can be caused by other medical conditions, also medications and/or trauma. Medical conditions related to glaucoma include diabetes, high blood pressure, autoimmune disorders. Certain medications like corticosteroids can also cause secondary glaucoma. Injuries to the eye or ocular trauma can induce glaucoma. Who's at risk for glaucoma? Patients over 60, patients with a family history of glaucoma, so parents, grandparents that have had glaucoma, those people should be checked for the potential of glaucoma. Symptoms to watch for. Most types of glaucoma are symptomless until the vision loss occurs, especially with open-angle glaucoma. But in some cases, you might be able to notice a gradual loss in peripheral vision, halos around lights, eye pain or pressure, especially with angle closure glaucoma. Redness of your eyes, headaches, nausea, and vision changes. But again, many people have no idea that they have glaucoma until the glaucoma is advanced. That's why regular eye exams are important and essential to maintaining excellent vision and good eye health. The way glaucoma is diagnosed is usually through a comprehensive eye exam. That includes measuring the eye pressure, checking the thickness of the cornea, checking the optic nerve, visual field testing, a CT scan of the optic nerve, and direct visualization of the patient's angle of the eye. While we can't cure glaucoma, we can prevent the progression and preserve the vision that you have remaining. Oftentimes, there's a need for prescription eye drops. Lasers can take the place of drops, oral medications, and even surgical options like trabeculectomies or drainage implant systems that are placed inside the eye. The key is early detection. The earlier we catch it, the more we can do to prevent vision loss, and usually the least that has to be done. Glaucoma really is the silent thief of sight. It can sneak in without symptoms, damage your vision quietly, and leave you with permanent loss in vision if it's not caught early. But here's the good news. When we catch it in time, you can protect your vision and often keep excellent vision for the remainder of your life. That's why routine eye exams are so important, especially as you get older. And if you're in a high-risk group, groups include patients over 60, diabetics, patients with high blood pressure, also with connective tissue diseases and/or using corticosteroids on a daily basis. Even if your vision's fine today, getting your eyes checked periodically can save your sight tomorrow. Because with glaucoma, what you don't feel can still hurt you. I'm Dr. John Michaelos. If you enjoyed this video, please subscribe for more content.